So this week, I am in the CDU, Clinical Decision Unit, my most hated assignment in the hospital. Why? Oh, a lot of these patients don't have to be in a hospital. They should have never got them in the first place. And some of them, because they're in a hospital, once you get in, it's hard to get them out. I'm talking about the chronic pain patients. But anyways, it's the short stay unit. People are only supposed to be there for 2 days or less. The government has a period called observation when you're trying to determine if they need to be in a hospital or not. But it's not quite what this is used for. This is used when the doctor and I decide it's too hard to fight with the emergency room doctor. Let's just admit the patient, get this over with. It's used for patients who should be getting outpatient care, but they can't really get there. It's used for patients who need placement. Medically, they're fine. They just need more help at home or to go to a nursing home. That's nothing medical. There's a high turnover. People change rooms. Rooms change people. They see lots of different doctors. Maybe a doctor admitted you, and another doctor sees next day, another doctor the next day. And what I've noticed is I have the best and the worst experiences there. Some people are very grateful for all the help I do. And some people just sort of hate me. A lot of people here are jerks, it seems, just more ornery than normal when I'm on the regular wards. And the question is, why? Is it a different population here? Is it because they're upset with all this change? See, the hospital and sort of society's impression is that people take care of you. Things take time. People need time to get settled. And that's the way it is for many of our older folks who are patients. Young people are used to meeting different people all the time, and they're more fine with it, but old people don't like that. And I don't think it's good either. You should know somebody. It takes you a while to get used to somebody else who's actually young was telling me when she was delivering her baby that everybody kept changing every day, and finally she had the same doctor 4 days in a row, and it was marvelous. And here you just have so many different people coming to see you. And we think it's just a turnaround. I mean, you're just supposed to churn them in and out, sort of like emergency room. But you don't have time to establish that rapport. You don't have time to talk about other things like, hey, oh, you're in Alaska? Hey, I was in Alaska last year. And you talk about, my time there when I was working in Anchorage. Talk about visiting different places. You got to go to Homer. I know it's far for you. You got to make it out there. This wonderful gelato place that won an award in Italy of all things, right? You would think, why? And one time in the summer, because, the sun doesn't set there, or sets at 1 a.m. I was there at 10 p.m. and I saw Italians and they tried to speak to them in Italian, but, this is America. Even though it's gelato, they only speak English. I'm sorry. And plus, the people working there aren't the actual owners. They're just, high school kids. But yeah, you don't have time to do all this stuff. I remember when I was in Sweden that there was a doctor, a cardiologist I was following, and he has 45 minutes for his visit. They get much more time in, Scandinavia, I presume, because, they have the luxury of time, they have money. And so the first 10, 15 minutes he spent chatting with the patient just about non-medical stuff. Isn't that great? You get to know the person, you get to know your doctor. And then you could talk business. Isn't that the way things work? You go out drinking, you go out partying first, get to know somebody, and then you talk business. It smooths things out. But no, that's the way it is, and that's my job this week. But I want to say that this idea of pushing everything, hurry, quick, right? Getting people in and out, is not good. It takes certain personality to stand up and say, no, what are we doing here? Aren't we supposed to treat the patient? And luckily I'm still at a hospital where you tell that to the case manager, to the nurse manager, they'd agree with you. You gotta make somebody better. Because one time I come in and they're gonna send this lady to nursing home, and wait a minute, she feels nothing better. She has a large amount of fluid in her lungs. Don't you want to do something about that? And then there's another case, right, where, the guy gets pressure. A lot of times you get pressure from colleagues. But I feel like sometimes you gotta say, no, it's more dangerous to do stuff quickly. The classic example of that being, you know, hyponatremia or hypernatremia, sodium levels too high or low, and a person sort of correcting it too quickly, you could damage somebody's brain to do that. But you might have pressure to get it fixed quickly, but no, that's actually a bad thing. Or blood pressure, or getting fluid out. So my patient had a lot of swelling in his belly. He gets sort of, we call it paracentesis. He has a shot liver from alcohol, and so he gets drainage weekly, and he comes in and he has a lot of stuff draining out. So we call it a umbilical hernia leak. It's leaking out of his body. The surgeon fixes it, but tells the other doctor, make sure you keep his belly flat. And the doctor aggressively puts him on diuretics, strong ones, and in combination that are synergistic. And he ends up getting his kidney shot. And, it's a syndrome called hepatorenal that's pretty deadly. So he ends up dying. Did we have to do that? Obviously, you could say it's better in hindsight. But we know sometimes hurrying and doing stuff too quickly is bad. It's one thing to take your own life in hand. We all do this. We do dangerous things because we want to save some time. We jaywalk sometimes. I saw a kid running across the street in Japan. Like, there's actually cars. I mean, even people in America don't do this sort of stuff. And the dangerous thing is in Japan, they're not used to people jaywalking like they are here. Here, if you drive in a downtown area, you just better be careful because if it's at night, there's people wandering the streets drunk. Daytime, there might be homeless people crossing your path and not caring. But, in terms of this concept of hurrying things, I think it's one thing to hurry yourself and take your own life at risk. You drive too fast, if you crash, it's bad, but you gotta get there. But it's a completely different thing when you put someone else's life at risk and you risk doing serious injury. And so you just gotta say, slow down. Slow down. This pressure I have, yes, I feel it, but I'm gonna deflect it. I'm gonna ignore it and say there's no hurry. And so, back to the CDU, the patients who are here, sometimes they feel pushed to get out. And I like to tell them, look, there's these government rules, but look, I'm caring for you, for the best for you. We'll take care of it. Don't worry about it. And when you just have one day and you're supposed to get them out and they're actually ready to go out, you don't have time to do all these things. And maybe they're actually very pleasant, but it takes some time to get to know them. Or maybe they're normally very nice, but they've just had so many difficult experiences here, so many things gone wrong. So many times repeating themselves over and over, the same thing to different doctors, to different staff, that they're tired and sick of it. But what can we do about it?